New York, first for you with Body Radiosurgery. We hit your cancer from head to toe with no cutting, no bleeding. We have decades of experience with primary and metastatic, large or small cancers. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are the best results and quality of life. Hi, I'm Dr. Gil Lederman. For a free booklet and DVD, call 212-CHOICES. 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. We're super convenient, Broadway and 38th in Manhattan. Hyperthermia 2. To hit your cancer, call 212-CHOICES. 212-CHOICES for Radiosurgery New York. For prostate cancer treatment, results and quality of life matter. Hi, I'm Dr. Gil Lederman from Radiosurgery New York. Our enviable record includes treating thousands with prostate cancer. Critical to every man with prostate cancer and their loved ones is quality of life, urinary and sexual, and great treatment data while avoiding surgery. Treatment here is outpatient, with most insurances, Medicare, Medicaid accepted. First in America with radiosurgery for cancers from head to toe, we have the expertise to hit the cancer. Our fresh second opinion could change your life. For prostate cancer treatment, call 212-CHOICES. 212-CHOICES. Radiosurgery New York, super conveniently located in Manhattan at 38th and Broadway, hits the prostate cancer. Call 212-CHOICES. 212-CHOICES to hit the prostate cancer.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
Hey, we're back. Good morning, we're back. I'm here with John and Ariel.
Morning, Dr. Ariel.
Hey.
All of you guys. So if you have questions, you can call us at 800-848-9222, 800-848-9222. I know a lot of you would rather talk privately to me, and you're welcome to do that. If you call after the show, our office number is 212-CHOICES, 212-CHOICES, 212-246-4237. We have the booklet and the DVD available for you about our work. We have booklets about brain cancers, we have it about body cancers, and we have it about prostate. So there's 3 separate booklets. We're also in the middle of Manhattan, so there's only 50 million people that come to Times Square every year. And if you're one of them, you're welcome to come by our office and pick up the booklets and DVD in person. We'd be happy to give them to you. And also we'll save postage and we'll be environmentally proper.
Hey, it's
right?
a nice place to visit. I got to tell you.
Yeah, John, you come over all the time.
I was going to say, I probably see you, once a week, and it really is.
Yeah, but you like our staff. You like the people at the front desk. They're so nice and friendly.
They are very nice and friendly.
Yeah, we have the best group. We speak so many languages, French, Russian, Farsi, Filipino,
Spanish.
Italiano, Espanol, English,
Yep.
Ivrit. So there's a lot going on.
Yeah,
in
not
our
too many
office.
places. I mean, we are in New York City, and there's not too many places like that.
Yeah,
and
well,
I'll
we're
be
very special.
Be
And
honest
we try
there,
to
so.
respect everyone's
It's true.
individuality. We also have booklets in those languages. Did you know that?
No, I did
we
not.
have booklets. So you want a booklet in Italiano, just call us at 212-CHOICES, and we'll mail it out. We have booklets. Actually, we have a DVD also in Italian. So my name's Dr. Lederman from Radiosurgery New York. We treat cancer, and we try to give good second opinions. And if you have a question, we'd encourage you to call 212-CHOICES, make an appointment, come in, and as my grandfather would say, sit down and close the door and stay a while.
Stay a while, yeah.
We take most insurances, Medicare, Medicaid, even though we're a private center, and you get the best of both worlds. So we had another interesting case. We have a lot of interesting things. So we had a man who was on the stretcher going to the operating room for prostate brachytherapy.
He was on the way.
He was on the way. He was 45 minutes away from getting his seeds put in elsewhere, and he calls me up, and he says, Doc, I have a feeling this is not right.
From the stretcher.
Yeah, from the operating
It's laying out
room.
that those feelings can
at a
come
hospital.
from all places. So
Well, but you can
made the call.
imagine, sometimes
Yeah.
you think the clearest when destiny is in front of
that's
you.
right. That's right.
And what happened?
Well, he had a Gleason 7 cancer.
So that's intermediate.
So Gleason 7 is how it looks under the microscope, right?
Uh-huh.
And he had previously seen our book, page 14, Gleason 7, or PSA 10 to 20, from 2 major Ivy League hospitals versus our data. And we keep our data up to date, fresh and airy. And he knew that seeds only for Gleason 7 or PSA 10 to 20, seeds only, had a 30% success rate.
30%. 30%. Outtreated at elsewhere.
Elsewhere general.
30%.
Now, if those same patients came to us with the PSA 10 to 20 or Gleason 7, the success rate is 90%. Okay, it's right there, page 14. We've published our data. We put it in a book. You can read
Happy to
it.
show it to you.
So this man was sitting there on the stretcher thinking, do I want 30% or 90%? 30% or 90%? 30% or 90%?
I hope he wasn't thinking too long.
Guess what he decided to do?
He walked off. He got off the stretcher.
He called 212 Choices.
Yeah.
He put his pants on, called 212 Choices, and came over to talk more with me. He says, Doc, I know your treatment's better. I want to go with you.
And I'm sure you saw him the same day.
We see everyone
Yeah.
that wants to the same day. We don't believe in making people wait.
Yeah, it's
We
not
think-
something you can really sleep on.
We think making people wait is cruel.
Yeah.
And we promise we have something called the Urgent Cancer Consultants. We'll see patients guaranteed within 1 business day. So you don't have to wait years or months or weeks to get the proper opinion and find out what's going on. Give us a call at 212 Choices. So for this man, he got off the stretcher, he came in, and he's ready to start his treatment. He's starting. I actually saw him yesterday, and he's so comfortable. He lives on 57th Street.
Mm-hmm.
He had a little bump on his forehead. He took a shower and had a little bump on the forehead. He came over at 4:30 yesterday afternoon for me to check him out. So he's very comfortable.
Yeah.
He has my cell phone number like my patients have. They can call day or night. And he has a new level of care. And he feels like he has a doctor who cares for him. And we want people to feel that way, and they want to be comfortable. They can come in. We know your name. We know who you are. We know why you're here. And it makes it a more homey environment to be treated. And that's how we would want to be treated if we were patients, right?
Sure.
Yes.
So that's our patient. We have also a couple other patients I want to report on. One woman who I've known for 20 years was smoker, and guess what? And I told her for 20 years, she actually worked with me, and I told her every day, please stop smoking, please stop smoking. And like many smokers, she thought she was invincible, right?
Mm-hmm.
And in 2008, she developed lung cancer. And luckily, it was caught before it spread.
Yep.
She had surgery. And she did great from 2008 to 2013. 2013, it recurred in the same area. So we're talking about the crumbs.
Mm-hmm.
You know, if the surgeons are so great, there wouldn't be recurrences. So it recurred in the same area. And she had radiosurgery. So compared to having open surgery, so 5 years ago she had surgery, she's still having pain, still requiring narcotics from the thoracotomy. Thoracotomy is...
You open up the thorax and
I don't do it. You don't do it. It's opened up.
It's opened
The
up.
thoracic surgeon opens up the thorax, the chest, and he
And-
cuts through ribs and nerves. It's often very painful.
It hurts.
It hurts, and often hurts for a long time. So she's 5 years, 6 years later, still having pain. So she came to us. She had radiosurgery. So what's radiosurgery about?
Yeah, what is it about?
Well, you know.
It's very precisely delivered radiation to the tumor, and you try to avoid the healthy tissue.
Right. So we make a stereotactic frame of the patient.
And that's just a frame to...
It's custom made for the patient. It's painless. It allows us to direct the beams of radiosurgery just to the cancer, not hurt healthy tissues. 5 treatments. Each treatment's 15 minutes. You come in, get your treatment, and go out. This woman's sister used to work in the wholesale dress industry, which is nearby. The fashion district is
Sure.
nearby. That's why all
Yeah.
the beautiful people are walking up and down the street. So if you come to our office, you'll see all the models, all the 6-foot girls and guys and supermodels. Sometimes people think I'm a model, but I won't go there right now this morning.
You and me both.
And she had 5 treatments, and she usually goes out shopping and gets, those fancy dresses at a discount because her sister knows the area. And she came back for a follow-up this week.
And how's she doing?
Perfect.
Great.
The cancer's gone. 5 little treatments, 15 minutes each. Compared to the surgery, and she's still having pain from the surgery. Wow.
Wow.
What a difference a day makes.
or a fresh second opinion makes.
So that's one case I want to talk about. Another case, and this woman actually is called, she's probably listening today, and she probably knows who I'm talking about, had multiple cancers wrapped around her bowel. She had wrapped around the bowel. The surgeon said he couldn't help her. She's refused chemo for good reason. We treated the multiple areas. She's now eating solid food. She's eating steaks and other things. The pain is gone and living a normal life.
That's huge quality of life.
It's a huge quality of life. She's completed her therapy. She's going to come back in 3 months for checkup. She has my phone number to call day or night. Incredible. A month ago, she thought she was doomed.
Yeah.
A month ago, she thought she was doomed. She just wanted to live an extra day. Now the pain's gone. She's eating, carrying on normally. This is Dr. Lederman. We're at 212-CHOICES, 212-246-4237. Our office is at 38th and Broadway. If you have questions, please call during the week. You can call after the show or during the week. If you wish, we'll mail you a package of information. The best thing is to make an appointment and come in. Spend an hour or two, sit down, close the door, and let's go over the facts and get to the bottom of this. So we wish you all well. Thank you, John. Thank you, Ariel. God bless you all, and we wish you all the best possible health. And
thanks
God bless
for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. This is Rob Redstone. Till next week.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board-certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
This is where New York comes to talk. Legendary 77 WABC, New York, a Cumulus station.
From ABC News, I'm Dave Packer. American civilians among 21 dead after a Taliban attack in Afghanistan.
4 UN employees, 2 Americans, and a senior International Monetary Fund official were among those killed in the suicide bomb and gun attack on the Kabul restaurant. But a UN spokesman says the organization remains committed.
This won't change it. The UN here, of course, is committed. It has been for the past many